There will be a little time lag between this webinar and the YouTube live. So the webinar is live now on YouTube, and I will, my mic is not muted, I don't know. So the webinar is live now on YouTube, and I will, my mic is not muted, I don't know. Okay, so can everybody hear me?
Yes, sir.
All right, thank you so much. So now that we are going live on YouTube, I'm going to also start sharing my screen for all of you to be. So, thank you very much, all of you, for joining in. There's so many things going on the web portals these days about so much of information is being given, and I am so glad that you all found yourself time to be here. I will once again
मिलकर एक गराज खोलेंगे.
I would request all the participants to kindly please mute yourself so that it is not a disturbance to
अब हम भूखे भी नहीं है यार.
Well, I'll have to mute everybody.
Out of the mouth, then start the entire process. Okay. This is the frame that I'm telling. I told you. This is an opaque sheet. This is a medium sheet from Armagedōn. So I cannot place it.
Okay, so now I have muted all the participants. Okay, so before I begin, I would like to give you a disclaimer on this webinar, since it's going to be live on YouTube as well. That this may not be construed as a professional or a medical or a dental advice. The sole purpose of this webinar by me is to create an awareness of COVID-19 related dental issues and the practice for dental surgeons and or dental specialists. So I will like to tell you one thing, that if you have attended any of my previous webinars on leveraging your practice, they were primarily aimed at under routine circumstances. In my part 4, I did mention that we may have to alter the way we practice and the way we present ourselves to the general public now as dental professionals is going to undergo a massive change in the way we are going to not only practice, but how we now learn. And the learning curve is going to be very tough, because we now need to get prepared once the lockdown is down and is taken up, and when we all of us resume our practices, what is it that we can do? So before that, let me tell you that when I say that dentistry is set again at crossroads, we are set again at crossroads. I remember my days in BDS, that was way back in 1980s, 85 to 1992, when I did my BDS and MDS. The whole idea at that point of time was focused on AIDS and other infectious diseases that a dentist may get while treating patients, like hepatitis, AIDS, tuberculosis, of course, the seasonal flu and other aspects which are contagious from direct contact. So in those times, there was a huge awareness campaign that went on, And the dentist then started wearing lots of protective equipment, including masks and gloves and head caps and uh, protective glasses and protective aprons and personal protective equipment. So as we are talking this, it's not new that we are using the dental um, protective equipments or the professional protective equipments, as we may call them. It's not new. There's nothing new about it. The only thing is about the other aspects of transmission of the disease within our own setup to you as well as to your staff, and a cross infection to other patients. There is plethora of information available on the websites, on WhatsApp, and on a couple of webinars that are being going on about the COVID-19 and dentistry, what is related. I did a PubMed indexed search and I found 51 articles when I typed in dentistry and COVID-19. And I came across some very interesting articles, which I'm going to begin with in my lecture. So, but yes, we are at crossroads again. We have been at crossroads for many years. Dentistry has always been evolving, and how much do we evolve ourselves is the way that we can keep pace with the developments of the uh, progress and the demands set in by special situations like this pandemic. I would be calling this as a dual pandemic because it's not a COVID-19 SARS pandemic alone. Usually, whenever there is a pandemic, it is the disease which becomes widespread over the world, and WHO then uh, declares it as a disease which is pandemic. The another important thing which has set in at this time, which is very important for us to understand, in times of, especially in the times when this we are uh, so what happens is that we need to understand is that we need to be prepared for eventualities. Ultimately, what happens is that if we don't get ready, that is where you mean that you are at a crossroad. Now, which road do you want to take? Do you want to continue practicing dentistry? Do you want to diversify yourself from practicing dentistry? If you are a very senior dentist, um, if you're planning to retire and then maybe take on some other profession, and maybe many of us have invested a huge lot of money, and we have lots of liabilities, and we need to come out in a very shining manner fighting this pandemic. And what I was telling was that it's not only that we are facing a COVID-19 pandemic, the world is facing something known as an economic pandemic, which is going to be equally difficult to tackle, because once the things get a little normal, maybe what will happen is that we will have uh, situations where there will be a crisis where people will not be able to have enough money, including the dentist. So we need to take a call now. What is it that we need to do? We need to act now as we are talking. We don't need to wait till we are allowed, or if we decide to go back and work in our respective practices and start treating and diagnosing patients. So we need to be very careful, and we need to do things right away. As I said, this is my personal information which I'm imparting, which I have gathered from PubMed as well as from a few speakers. I want to give credit especially to Dr. Jack Dellinger, who gave a webinar on integrating oral health with primary care. It is available on Colgate Oral Network, which is freely accessible. I would always ask you to go through that webinar if you want to get more insights. I also have a mentor who has given me this two documents, which are uh, who will finally survive. what will make us finally survive this COVID-19 in business and in practice, and also on the why this is also an economic pandemic. So, having said that, I will now go ahead and start with the first thing that I came across was this article by Coulthard, which has been recently published in the British Dental Journal about the moral decision making, dentistry and coronavirus. So what is this? What is exactly has been told is that we have been challenged, and the uh, health professionals probably in the recent past 100 years have not been challenged so much that we need to have an organized urgent care delivered by teams. And dental professionals, we know this. The article says that we can contribute to medical care, and major reorganization of both clinical and support services is not straightforward. So, dental professionals may feel a moral duty to reduce routine care for fear of spreading COVID-19, but are understandably concerned about the financial consequences. Amidst the explosion of information available online through social media, it is difficult to identify reliable research evidence and guidance, but one has to make a moral decision. I will be once again taking an advanced webinar again only on the review of literature that is available on dentistry and COVID-19 on various platforms of PubMed, Science Direct, if available on Cochrane, Wiley Online. These are all the various portals which I would advise all of you to visit and try to read what literature and what has already been published in the last 1 month. There are so many articles which has been published at the PubMed level, which is very reliable information because they are all peer-reviewed journals, and all information that all the articles which are accepted undergo a very high level of scrutiny before they are made available. And most of the articles right now, even for the paid subscription journals, most of the articles on COVID and dentistry that I came across, including this one, are available free in full text. So, what do they say about the healthcare? I also read about this article. This says about the socio-economic implications of coronavirus and COVID-19 pandemic, a review in the International Journal of Surgery. And in the healthcare, it says it is not mentioning about India, but there is in the US, there is a concern regarding uninsured individuals who may work in jobs predisposed to an increased risk of the viral infection, which may lead to significant financial consequences in the event of an illness. So this socio-economic implication on healthcare as far as we are concerned. This article also very in-depth discusses the economic, socio-economic implications on other sectors. Now, for example, they say the other sector is tourism, which is going to be highly affected. Many of the dentists in our country are dependent on dental tourism. We have episodic and periodic, seasonal variations in the patients that walk in, as per the tourists that they arrive. And when is the tourist season? These all factors combined with other economic factors is definitely going to bring down the spending capacity of a person. And then when we are imparting dental care, how you should place your practice as now becomes very important, because I think now one thing is very clear, that cosmetic dentistry, aesthetic dentistry, giving people the idea of enhancing their smile aesthetics may not appeal to a great extent. You will have to shift to the need for proper dental care. We can also emphasize on, if you're trying to emphasize on the smile enhancement, we can emphasize that it is not just about looking good, it's more about feeling good. And I will be discussing in my presentation today about why feeling good is so important in these times and turmoil that the whole world is undergoing. So you'll have to, leverage yourself to a level. Now, as I said in my previous webinars about thinking out of the box, I think the time to think has lapsed. It is a time to act. And there is enough evidence now in the literature as well as in the other aspects and the other published literature beyond medical science that there is going to be a huge impact. And if we don't try and leverage ourselves to the newer demand that has now come at the forefront, we will be facing a lots of issues. The another article which I came across was the COVID-19 outbreak and its monetary implications on dental practices, hospitals, and healthcare workers in the postgraduate medical journal. So they are saying that medical is a profession where dentist works in close proximity to the patient's mouth, and many procedures produce aerosol, which is a mixture of water and patient saliva or blood. Now, these aerosols could result in the spread of infection, including COVID-19. In a recent article published by New York Times, identified dentists who had the highest risk of getting from their patients due to the cross infection. Due to this, many regulatory bodies have advised the registered dental practitioners to perform only emergency dental procedures. We have been advised by our Dental Council of India, the Ministry of Health, and by the various dental associations that to avoid, and I'm going to later on now talk in my lecture what exactly do you mean emergency dental procedure, what is elective procedures, and why elective procedures is a very gray area. All right. You see, I'll be discussing in depth a little bit what from Dr. Jack Dellinger spoke on his webinar, that distinguishing between emergency and elective treatments is going to be the newer challenge, and that can leverage your practice, because you see, you have to now think, act according to the newer need. Extraction of asymptomatic teeth, aesthetic dental procedures, orthodontic adjustments, and routine intraoral radiographs, right? So many articles that I came through have advised extraoral radiographs. So now the OPG and CBCT will become a better diagnostic tool rather than intraoral x-rays. But however, many clinics will not be equipped with an OPG and dental x-rays. So till such time, you will have to rely on imaging centers. And it would be very prudent not to take intraoral x-rays for the time being when there is, unless you are taking all adequate precautions as have been so far published. The another article which I came across, which is very interesting, is about social media and telemedicine for oral diagnosis and counseling. Now, you see, there is a couple of apps available, which I came across after hearing Jack Dellinger. One of the app which he described was Tooth Floss, which is an app which can you download. We can actually, what I am planning is to create an app of my own clinic where all my patients can have an understanding of what is dental healthcare. And also on my YouTube channel, I have published a couple of videos explaining to people what encompasses oral healthcare, what are the various diseases or the ailments that you may get if you are not taking proper oral health care. And the third would be the various oral home aids that you can use, especially during these times, which a person can, take adequate precautions so that they do not develop any dental ailments. There will be a fourth video which we have recorded, which will be uploaded on the YouTube channel, would be on the treatment parts. So that comes secondary. Now the treatment part is going to change drastically. We may have to go back to the basics, and we may have to do dentistry because as we know now that we cannot use the aerosols for the time being. I'm going to see there is a lot of people already talking on disinfection. And there is a website of the World Health Organization, and I had also shared in the WhatsApp groups which I have created for the webinar the link for WHO, where you can undergo training and get certificates. So I'm going to show you a certificate that you may get, which I personally feel you should attend each and every presentation and the course which are available there on the WHO website, where you will receive a certificate of undergoing that course. So that may be very useful to you in becoming more credible, that you have actually understood what is required by dental professionals as well as health professionals as far as infection and prevention control is concerned in these critical times. So you can make use of the social media now, and social media, they see the blessing is, that we have a social media. We are able to get ourselves educated right now. I am here on this webinar. You are here to listen to the webinar. It's all thanks to this technology. We should be grateful for what we have right now. let us be grateful that we have this platform of imparting knowledge, of gaining knowledge. I also, like you, attend many webinars and try to gather as much information as I can so that I am aware of what is going around, what is proposed, and what is likely to be there in the future in store for all of us so that we can take an informed decision now. There's another article, which is a very nice article, which I found to be very useful. Is this article? I would request all of you to look at it. It is there available. It's guidelines for dental care provision during the COVID-19 pandemic. The work is aimed to develop guidelines for dental patients management during and after the COVID-19 pandemic. Guidelines for dental care provision were developed after considering the natural COVID-19 pandemic and were based on grouping the patients according to the condition and need and considering the procedures. You see, this is very well defined. They have categorized, the patients. I'm going to show you a couple of graphics from which I have taken from that presentation with due credits. Is that, you see, the screening number one is you have to screen every asymptomatic, because you see, there is enough evidence which says that 80% of the people who have COVID-19 at this present moment are absolutely asymptomatic, and they being asymptomatic is a big risk to us. So we have to consider every patient as an potential asymptomatic COVID-19 carrier. So how do you make a screening? Now, considering recently recovered patients as potential virus carriers for at least 30 days after recovery confirmation by a laboratory test. So it is very important now that we have a triage. Now, this triage is a concept which probably was not heard of in our country. I have attended a couple of American Dental Association programs where I worked as a volunteer in a community health dental treatment program, where I, being not a licensed practitioner in America, I used to sit in the triage area and we used to take the history of the patient, documenting and just taking basic information. So you see, that is where you are not exposed to the patient, where your dental staff who is well trained will do the screening procedure. And now we have so many avenues of knowing. This particular article is very useful. It is a PubMed Index published article, which also considers. So you have to consider every patient that walks as a potential, not asymptomatic, but is a potential asymptomatic COVID-19 carrier. You have to identify the need of the patient and focus on managing with minimal invasion. Categorizing dental treatment according to the urgency of the required treatment. You have to categorize A, B, C, D, which the article very nicely exemplifies, and the benefit associated with treatment if imparted. So this is a graphic which they have suggested that be used screening, and it's directly bifurcates into a confirmed case and an unconfirmed case. Unconfirmed case is asymptomatic and symptomatic. Now you have to categorize them into A, B, and C. A symptomatic suspected patient goes to the A category. So you have to be careful. You see, active disease, recovered patients, unstable, stable, all these guidelines are there, which I would suggest that you please display and train your staff. The another important thing which I feel the need, and I'm going to cater to it, is that now most of the information available on COVID-19 and dental health and the dental practitioners and how we are going to practice is in English. And you see, we all are practicing. We have dental assistants and staff, including receptionists, who may not understand English. So there is right now a huge need for addressing these issues and explaining in vernacular languages to the respective dental team members. And I promise you, I'm going to conduct that program very soon. Now, you see, what is A, B, C, D from the previous thing is A is an asymptomatic, unsuspected, unconfirmed COVID-19 case. B would be a symptomatic and or suspected, unconfirmed. C would be a stable, confirmed. D, unstable, confirmed. And E would be recovered. So you have to categorize your patients into these 5 categories. And then based on those 5 categories, now you have to categorize a treatment for them. Emergency management, if required for any life-threatening conditions. For example, there is a swelling in the floor of the mouth, which may obstruct the airway. You see, there will be oral surgical procedures. There may be certain issues which is complicating the present condition of the patient and also requires oral health care. There are urgent conditions which can be managed by the dentist alone with minimal invasion and without aerosol generation. We may have to go back to the days where we do, manual excavation of caries. I mean, you will require caries solvents. You will require material which arrests the caries. You see, right now the whole purpose is that we have to address the disease. We should be more concentrate on the disease now rather than the treatment. You see, the treatment is very clear now. You cannot use an aerosol. You are risking yourself, you are risking the patients, and unless your clinic becomes completely equipped for complete sterilization of all aerosols and surfaces, it is very dangerous to use aerosol dentistry till such time. There will be seized an urgent dental need which will be managed with minimal invasion, and or aerosol generating procedures, non-urgent procedures and elective procedures, right? So you have to categorize and you have to tell the patient that you are belonging to A, B, C, D, E, and if you follow this, it becomes very easy for you now to categorize, and you will become more confident in presenting yourself to your patient right now. There is a new concept right now which is known as a phone triage. You see, you don't need to actually wait the patient comes to your practice. That can be a phone, a simple phone call conversation can solve, and that is where teledentistry is now the future. We need to, look that now as a model, maybe, and I am trying to evolve a model on a lot of aspects where dental care can be taken care of in a different way. So we have this treatment considerations now. Now there will be intraoral imaging, as I said, should be restricted according to this article. Extraoral radiographs should be utilized to reduce excessive salivation. All right, and the other associated problems with intraoral radiographs. Another thing which we must do, which is well published now, is 0.23% povidone iodine mouthwash for at least 15 seconds before the procedure can reduce the viral load in the patient's saliva. Disposable and single-use instruments should be used wherever possible to reduce cross-infection risk. Now, rubber dam application is now a new thing, which will be now, it's again, they have quoted Cochrane review of 1989 on rubber dam should be used whenever possible, as this will significantly reduce the spread of microorganisms. And the dental treatment should be as minimally invasive as possible. Another article which I came across was the current view of dental journals and the coronavirus disease. Now, you see, this was published on 2nd of April, almost 20 days back. But since then, a lot of other articles have come, but I found it prudent to mention here that people are already doing review of literature and publishing articles which says that considering the significant number of dentists around the world working at this time, it is necessary to reflect and act quickly to better enable them in dental treatment in the face of COVID-19 challenge. We may remember that the history of epidemics offer considerable advice, right? Which I really like this statement, and only if people know history and respond with wisdom. You see, I began my webinar with telling you this about the pandemics, not the pandemic, but the threat that was looming on the dentist and the cross infection in dentistry since early 1980s, with the advent of especially hepatitis and uh, uh, AIDS. So that was a big risk. Now we all dentists are compulsorily now getting vaccinated. All medical professionals are compulsorily getting vaccinated for hepatitis. I remember I was in my higher secondary school when there was a pandemic on the hepatitis in Gujarat, where a lot of doctors had actually got infected and they lost their lives. So it is not the first time that the medical or the dental world has been exposed to this kind of situations where we are at risk. Okay. So that is why. Well, I think there is somebody which I'll have to remove from the. So please bear with me for a while. I'll have to stop sharing. There is some person who is trying to. Just a moment, please, because we got somebody here who's. I'll have to remove him because. Yes, I do agree with you. There is somebody who's. I'm checking the chat. All right. So. Mm, Previously, what we can, because this we have the email addresses of everybody. This is a very well. It cannot be hacked. There is lots of precautions that has already been taken, and anybody who does any mischief is removed from the webinar. So I have done that now. We can start sharing the screen again. All right. I have removed that person. So, all right. Now, coming to the, we'll just once again go ahead with our main task of today, and that is. So this article, which was again, Dental Journal, which says that we must remember that history has taught, and we need to understand from history in the past pandemics of how it has changed dentistry, and we need to understand that very, very, very crystal clear that we are facing an issue, and we need to address it in a manner that we can take care of it. So the another article is a pinch of prevention is worth a pound of care, proactive dentistry in the wake of COVID 19, which also makes a very, very interesting reading because, uh, it's uh, tells us, just a minute, sorry. Okay. So protecting healthcare workers and patients is of utmost importance. We must focus on future outbreaks, which we see this outbreak can recur. And when it recurs, we don't know the scale of how we can control it. So we as professionals should explore methods for reducing transmission of all infectious agents. Now, external mouth suctions, which work like scavenger systems in our nitrous oxide devices, are now being currently tested, according to this article in Korea. Commercial air purifiers and air exchange devices are also being explored. Creative negative pressure operatories might seem a drastic and expensive approach right now. However, in 40 years, dentists might think that we were ludicrous for working without them, just as we judge those before us who did not use gloves. I'm telling you, there was a time when dentists were not wearing gloves. Now, you see, so we need to understand the only question is that when and how will this pandemic affect the delivery of care? And dentistry accepts the advances or continues our history of fighting the challenges less. So this article is also very interesting. This is another article which says that what are oral emergencies: acute pulpitis, periapical periodontitis, dental trauma, maxillofacial infections. Parents and children should visit the clinic in time with correct personal protection during the epidemic period. Children's oral emergencies should be treated accordance with the current guidelines of and control of COVID-19. So this article also mentions what care you should take. there is an emerging and future challenging for dental and oral medicine. So this is also a very interesting article, which is based on their experience and relevant guidelines and research, introducing essential knowledge about COVID-19 and nosocomial infection in dental settles, and provides recommended management protocols. So it is worth reading this article also, which is recently published, and it makes a very good sense to understand that what management protocols for dental practitioners and students equally, because I gather there are a lot of students also in this lecture today, to how do you manage in potentially affected areas. So having done that little bit of PubMed indexing, I would come to something which I have come across myself. And again, a disclaimer that this is not, I'm not an economist. But it's been everywhere that how the economy, because there's no work, the industries are down, there is cash flow issues, there is going to be a huge economic pandemic. Are we prepared for that? So in India, for example, all those who were born before 1991 would know that India had a closed economy, and we were more Swadeshi that time, and the imported devices or anything which we used to get was only from people who used to visit India. It was in the 1991 when we decided to open up the global economy. There was a huge industrial output, and comfort seeking consumerism took place also in India, which is a capitalist consumerism, which led to climate changes. Now, I'm not an expert to deal with why and how this affected, but you see, this climate change or whatever may be the issue, because of this economic pandemic of COVID-19, India too will be affected. And that has set in a fear amongst us of how to deal with this. So, uh, okay. So there are a couple of people here who are writing on the chat. So anybody who writes anything on the chat, I will be removing them, immediately. So please refrain from writing anything on the chat which is distracting the people, and so that we have an uninterrupted session. I would request all of you to please maintain decorum of this. Or else I would request the people who are, unsolicitedly present here in this webinar to kindly please exit. Or else I'll be forced to close this webinar, because we don't want a threat to all the participants. Dr. Neha, if you can unmute yourself, can we have a conversation on this, please? Okay, so I will just remove them. I'm really sorry for this. We'll go back to our webinar. Since 1991, as we said about the globalization, and India has undergone a huge transformation, and we are also, that helped dentistry in a way, because it increased the consumerism, and people then were willing to spend more on their oral health care, not only for functional reasons, but also for aesthetic reasons and for their well-being, which in turn now is going to see a huge reversal. And so now, to leverage your practice, you need to come to an area where you would be changing the way you practice. So the fear, now you see, the fear is there primarily because, you see, if you go read all the pandemics of the past, the bubonic plague or the Spanish flu or the cholera and AIDS and hepatitis, and you see these, there was, you see, here the human is the main intermediary. There is no intermediary carrier or a host. Like for example, malaria. The protozoans do not affect the mosquitoes. They are just a carrier. So you need a mosquito, by human to human directly, it will not transmit. Unlike COVID, can be transmitted from one human to the other immediately. It's highly contagious. So a physical distancing has been mandated. Now, you see, another challenge that we are going to face is, which we already discussed and we already told you the guidelines. Now you should be prepared with that. You have to consider every patient that walks in to be an asymptomatic COVID positive patient, right? Secondly, there is going to be a huge effects on the psychosocial level. Okay, uh, let's talk about the dentist right now because it also includes dentists. It's going to affect us. So we have to become more stronger. There is no way out. It's if I am tense today of what is my future tomorrow, well, I don't think there is an answer. There is no place where you can go and seek that answer other than yourself. The whole world is affected. It's not just that you, me, dentistry, it's every profession is affected. There are countries, for example, I was just reading about Vietnam. Now, Vietnam, post-war became a huge tourist attraction. And Cambodia, Vietnam, these countries' GDP, Thailand, these countries' GDPs actually are based on tourism. All right, 7% of GDP of Singapore is from tourism. So you can understand that there is no tourism going to be there anymore for a very, very long time till this pandemic is a sure cure or a vaccination is on the cards. So I'm going to talk about that aspect now, which we have been talking already in the previous webinar series, but now very specific to COVID. You see, we are facing an Armageddon. You know what is an Armageddon? The world is a threat and the mankind fights against that evil. What are we doing right now? Isn't it most of the movies that we have seen where the mankind is a threat and there are heroes who come up and save the mankind? We all need to play a role. So now we all need to be a leader in some sense. Okay. And now we have to understand that there were commercial determinants of health. We must not deny this. Everybody was there, but now the social determinants of health will become more important. And there are, you see, there is a John Farmer who has multiple quotes and has done lots of work on social determinants of health. Even Jack Dellinger talked in his presentation about social determinants of health. I'm going to talk a little bit about that. We now need to understand that we need a cross-sector collaboration. We as dentists alone in a health setup which is individualized as a dental health care may not be enough in the times to come. We will have to make a partnership work where it works for your community with health as a whole, with oral health care a part of it. We may have to lobby very strongly to convince the government for inclusion in insurance for dental treatment and the other medical benefits that are provided to poor people by the government. I know there are certain schemes where some dental treatments are reimbursed by the government, but there are very few, surgeries and which are not too common, like dental caries, uh, malocclusion, um, periodontitis, loss of teeth, loss of function, impairment, oral cancer. These are still not majorly funded by the government right now. We need to understand that if we do not, leverage ourselves to that level, there are many hospitals today, medical hospitals today, which actually survive on, the healthcare. Okay, Neha, I'm so sorry for that. I'll just unmute you. So, Neha, I just want to ask you a question.
Yes, sir.
There were a couple of mischief mongers who
Yeah,
were
I was,
writing
yeah,
nonsense.
I'm very embarrassed about that, sir. I don't know
So
who
that's
are they.
okay, but I have removed them.
Yeah.
That's okay, right?
Yeah,
Right now,
I
we
was
have
watching
an
that. Yeah.
uninterrupted.
Yeah, okay, sir.
Thanks, Neha. So what happens is that because now we may have to lobby very strongly our various dental associations, our Dental Council of India. We need to talk with the insurance regulatory body, IRDA, and because tomorrow dental health care, if people don't have money, they are not going to spend money on dental health care. We need to emphasize that there are countries where dental health care is insured. But anyway, that's not the scope of the topic to discuss more. What we can evolve are also further that you young people can now think of is community health centers where oral health care is also integrated. This is going to be the future of tomorrow. And see, so like I said, we as a nation, including the leaders of all segments, especially of our dentistry, have one very vital point to appreciate and inculcate, okay, to fight this Armageddon, and that is confidence building. All right, and this confidence building among ourselves should grow at a much faster rate. Okay, guys, it must grow at a much faster rate than the twin challenges of COVID-19 and economic pandemic. We need to be confident क्या होने वाला है, right? So that attitude that we will overcome, we shall overcome, हम होंगे कामयाब. Now again coming back to Jack Dillenberg, who is the Dean Emeritus of Arizona School of Dentistry, I quote him saying that integrating oral health into primary care requires more than just treatment planning, right? Now we need to do more. We are not just now dentists who will diagnose and do treatment planning. We will have to collaborate, and very nicely he has, spread this collaboration word into coal. Coal means actually a bridge in a valley. When you are a mountain, the region between the two peaks, that is why when you see that on the gingival coal, right? Then the lab is actually your clinics, our places where we are working, right? And the oration part, we have to speak out and we have to reach out and tell people about dentistry. And that is what we have to tell poorer get sicker, and the sick will get poorer in the times to come. Is the father, this is said by Dr. Jack Geiger, who is the father of community health center. All right. So that is something. And to quote Theodore Levitt, is creativity is thinking up new things. But we right now not only need creativity, we need innovation in doing the new things. We must do. Now, see, we can just keep talking, right? For example, you see, this is a very nice quote which I have come across, which we can use now and tell people about making them aware. When a lot of people say, I'm sorry for the typo here, it's not flood, it is floss. Uh, it says, some people ask, should I brush my teeth or not? So the very nice question answer is, don't floss or brush all your teeth, only floss and brush the teeth which you want them to be kept, right? So this, we need to be a little more jovial, we need to be a little more confident, right? So the steps which I attribute to my mentor, Mr. Ashwin Mehta, who also incidentally happens to be the ex-mayor of Baroda and who has been recently mentoring me of many things, has sent me this steps to confidence building, which with his credits I'm reading out here. First thing is have faith. Right? Believe in the Almighty. Okay, you may not be a believer, but at least believe in the karmas. We must act now to reap the benefits later on. And if I had turned up today being less confident with my worries, with my problems, my situation that I am undergoing right now, you see, I have to exude confidence. I have to inspire you all. A lot of you people here are students, young entrepreneurs. Share that confidence with each other, because we build teams together which oozes confidence. All right. Share stories of how once a downtrodden has awakened with confidence and has now become a ray of hope, right? You see, share those stories. I recently came across one video where one of the dental students has actually participated in the COVID-19 screening process, and she was interviewed by the news channel, and somebody has just forwarded me that message and forwarded to as many people as possible. You see, there are she's a dental student. She's a postgraduate in, she's doing post-graduation in periodontics in a college in Ahmedabad. And she has been volunteering. It's a proud moment. So these are the stories, where we're showing a ray of hope. Everybody is trying to do things. Tomorrow, there will be, the stories will now come out of how people have and what people are doing in these times. So share them, right? Collectively raise and kindle a fire amongst all of us that we are not scared. All right. And this is a very favorite saying of mine, which I always say, that together we can and together we will, at either individual level or collective efforts. The fruits are always reaped, and that will accumulate confidence. Progress always stimulates. When you make a progress, do something today which tells you that I have done something more than yesterday. That is progress, and it always stimulates. Another thing which, let me tell you, nothing lasts forever. Mankind and dentistry has these changes, these challenges in the past. Now, another way to leverage self-confidence is something which we all need to have in these times. There are going to be tough times, but let us face them and let us collectively try to come out of them. What are the ways that we can do? Working with medical specialists to deliver oral health as a primary care. That was not in India. We have not worked with our medical specialists to deliver oral health care as a primary care. We need to make them understand, educate them, right? So Jack, in his presentation in the in the oral network lecture, he mentioned that we should now reach out to our medical people, their staff. We need to make them mingle. We need to invite them to our clinics, and we need to try to understand that in what way can we be of benefit to them. You see, in my days, there used to be a book by Dr. S.N. Bhaskar, okay, an Indian person who actually written a very nice book on oral diagnosis. And there are blue pages in the beginning of that book, which are known as oral manifestations of systematic diseases. So you see, there are so many signs and symptoms that a patient has for so many systemic problems. We as dentists can diagnose medical problems primarily and refer them that this is a suspected case. Let me tell you my own story. When I was around 11 or 12 years, I had enteric fever. And my mother took me to a general practitioner, all right, an old man, an MBBS guy who had seen everything. He just looked at my tongue and he said, "You got typhoid." Of course, a Vidal's test was performed and it was confirmed that I had typhoid. But you see, that's my story, which I'm sharing with you. Uh, I will share another very interesting story. There are this yellow spots, which are known as Fordyce spots in the oral cavity. Now, this patient was misdiagnosed by somebody for Fordyce spots, which are nothing but sebaceous glands, which are, which come up and are visible through the submucosa as yellow spots. Now, they were diagnosed as an oral cancer. Now, see, this is how powerful we are. I showed him that, is absolutely no problem. But similarly, a person with white lesion, when a person comes to you, we can do a much broader diagnostic in the triage area and tell him about his medical problems. We need to integrate ourselves with the medical people. How there is a relation between dental problems and kidney, heart ailments. We all know what is subacute bacterial endocarditis. There is a Lincoln's Highway, which is a direct route to from oral infection to the heart. It is actually known as Lincoln's Highway. It passes down through your throat into the endocardium, and that is why dental infections can lead to valvulitis, endocarditis. So all these things we can integrate, and we can now work together with physicians. we must now start playing a key role in our practice as healthcare providers. All right, we are doctors. We have been trained. We have undergone, of course, to a certain extent and a limit, and we are not the proper persons to treat medical disorders, but we can have a play a role in at least initial screening and diagnosis. We all know auscultations. We all know there are things which we can clinically diagnose and then refer them out to the medical specialist as a suspected case. We do this routinely before placing an implant, don't we? We do this routinely before doing extractions. We take the medical history. We know there are certain medical contraindications, and then we always advise those tests. We can expand our horizons and we can become a more, a person of more importance in the overall healthcare provider system. Which we really liked about Jack. What he said about is that emergency versus elective procedure. So now, see, tomorrow you may say that this is an elective procedure, but in whom? Right? There are special individuals of special needs, right? Now, these are people of determination. Okay, these are, let's say, for example, the intellectually challenged people, the physically challenged people. Now, if they get a dental problem, would you still consider? So these are the people who are medically compromised, the elderly people, the poor and the homeless, disabled, okay, homebound people, they cannot move out, intellectually, spatially abled people. These are the people where a elective procedure may become emergency. So if you now start doing things which in a other way, it can get you more work. You see, money is secondary. I'm not talking about the commercial aspect. Right now, let us find how we can remain busy. That's the main issue tomorrow. Dentists are not going to be visited by people. We'll have to find avenues to keep ourselves busy in these times in the future. Dentists can become a very good and a powerful medium. Oral cancer is very prevalent. Let me tell you one thing that I remember. One of the oral pathologists, he came to India to study oral cancer way back. I don't remember the name, but he actually, there is a disease named after him, but he it's written in the book called Schaefer Oral Pathology. And a lot of study, for example, submucous fibrosis, right? It's so prevalent, right? Which can now become, you will have to cater to these issues. Now, what about, there is a hepatovirus related oropharyngeal cancer, which is preventable with a vaccine. All right. So these are things which we must understand, and we must try and talk and find out that now dentists can play a major role in primary healthcare, especially even in malignancies. We can be of immense help to the medical fraternity for improving their health and making them understand the importance of good oral health care, which if they themselves do, they will advise to their patients. It should exude from them that yes, oral health care is important. You don't go to dentist for a filling, for braces, for extractions, for a bridge, for an implant. The dentist has much more to do than these things. Now, that is why you see the social determinants and the commercial determinants on health are going to change. We have to make that notion be removed from people's mind. Dentistry is not expensive, it is valuable. You see, we have to attach the word value. Don't attach it with money. The money spent on oral health care is far less than people spend, otherwise. So another thing which I would advise now is that we must start working at odd hours. We can't say that I will practice from 11 to 12, 10 to 12, 6 to 9. We will have to work at odd hours. Another thing which I already spoke is we can have immense benefit out of oral manifestations of systemic diseases. We must improve our relationship with our fellow medical doctors and staff. We need to reach out to them and make them understand. You see, if you see today, the healthcare is divided into medical care, dental care, and behavioral care, right? The time will come whether there will be, the future would be of a health home where dental, medical, and behavioral care is combined. We work directly in integration with the medical fraternity. We now have to become more provider centric than patient centric. We have to turn to patient centric than provider centric. Like I said in the previous times about the expensive, we have to, because there is a value blind reimbursement, right? We, the reimbursement that we get, you see, I would use the word reimbursement for whatever work that you and me are doing in dentistry, right? It has to be reimbursed because everybody has a livelihood, everybody has a cost involved of running a practice. Everybody needs to generate that revenue. So right now there is a blind value, on what we are getting. We must have a value based, or what exactly that is we are imparting to patients, and what is that value, and that recruitment should be based on that value. We have this episodic and fragmented patient flow, right? In the sense that, like we have this NRI seasons, and then we have this dental tourism, and then we have vacations where kids go in for. We need to have a more coordinated and continuous patient flow by utilizing all resources. Another thing is, which is very interesting, which was shared by Dr. Jack, was that you make dentistry more accessible by telemedicine or dentistry. By you can make, the young dentist can actually start, that is what he suggested in his webinar, because he was basing it more on the American model where there are dental hygienists. What his suggestion was that dental hygienists can make home visits and do the triage there, and only bring in people to the practice who requires an intervention of dental care, right? So mobile dentistry, for example, mobile dentistry, I remember one startup which I came across around 3 years back, was on people carrying a whole dental unit and going home and treating patients, right? So there is lots of things that we can explore, right? We are more based on individuals, we have to be based on population now, and we have to effort should be that we have to make the population more aware on oral health. We have to now go to wellness and prevention from disease and treatment. Main thing, oral health literacy is so poor in our country. Let us make maximum efforts right now, and this is the time when the public at large is can get your attention. Make them literate on oral health. Start making videos, start propagating the message of oral health. Tomorrow your hard skills alone will not work. You will require leadership qualities, and you will have to sharpen your soft skills. We will have to integrate into primary care. We will have to address special needs of medically complex patients, aging people. We will have to make use of sodium diamine fluoride, pregnant women and their dental care, and teledentistry. These are the few things which you can use to leverage your practice tomorrow, either individually or with a community, or what the future tomorrow is, not only of a group dental practice, but it is a future tomorrow of group health care, where the healthcare is imparted under one umbrella. So what Jack said was, I'm just reiterating from his, I quote him here again, and from his webinar, he said that should be home dentistry is special screening for oral health care, and bring in only those people who need a dental care. Develop smart. So for example, you see there is an Arogya Setu, right? We all have downloaded it on our apps, which is a COVID, an app. Similarly, we can develop a dental app which patient understands for their dental health needs, and a lot of things can get answered on that app. As a leader now, we will have to establish vision and share it for others to follow. Step in right now in this crisis, and a leader is one who is able to think and act creatively. The word is not only think creative, act creatively in this difficult situation. For example, you see this, the Association of the Dental Surgeons Association of India. We have Dr. Neha Gaur here. We have Dr. Robin Malik. You see, these are the people who are leading they're working, selflessly right now, trying to propagate the message as much as possible. These are the leadership qualities. We have to act. Everybody has to do. I remember one poem, long back in my dentistry days, when I was doing my dentistry. There was a small poem. I don't remember the whole poem, but they said that be the best of whatever you are. Everybody cannot become the captain of a ship. You may be a crew, but become the best crew on the ship, right? It says that everybody cannot grow into trees. You may be a shrub, but become the best shrub on the roadside, right? So these are the, whatever you are, this is the time, bring the best out of you. Work at something that you enjoy. Okay, for example, at present I am learning, there is an app which is free called Duolingo, all right, which teaches, and I'm learning Latin. Latin is such a interesting, if you learn Latin, most of the medical terms, you will understand automatically. Anybody who is reading anatomy, who knows Latin, anatomy becomes very easy because all the terms, medical terms, are based on Latin, right? Including the word dent, don means teeth in Latin. So this way you can do more things. Right now you must get engage yourself. Give give more than what people expect, and be cheerful about it. Don't make it look like, I'm doing this for people. Be cheerfully, you're doing it for your own sake. Just give as much as you can give right now. You will definitely reap lots of harvests, later on. Okay, so become the most positive and enthusiastic person you have ever known. Look yourself in the mirror tomorrow. Right now, after this webinar, go and look yourself into the mirror, and please praise yourself. Be proud of what you are today, whatever stage you may be. Okay. First thing, again, this Jack, I liked it very much, is forgive yourself. And this is the time that we need to forgive ourselves. We all make mistakes. Okay. Everybody has made a mistake. And right now, be generous, be grateful for what you have right now. For example, I told you in the beginning of the webinar that we are so grateful for this technology. What if this technology was not there? People had to sit at home and do nothing, right? Persistence, persistence, persistence. Don't ever give up. Be loyal, be honest and humble. That increases your credibility. Be bold and be courageous. Be impeccable with your word, right? This is the time to be, you speak what you mean, and you mean what you speak. Don't take anything personally. This is for your own well-being right now. Don't make assumptions, right? There are lots of material that is going around. Go for, information which is very credible, which is very authentic, and then just do your best. Okay, always. So another thing is what you can leverage, which I would talk, is increase the access and reduce the cost. You see, when we talk about tele dentistry, right? A lot of people are doing tele consultations. There is this one person asked me that, do you know a dermatologist? And I called up and he said, yes, I can do a phone consultation. They have to pay money into my account. And then I will do a video call and see what problem he or she has. And I will consult online. I think recently they have been permitted. Uh, recently they have been permitted recently we have been permitted I think I'm not too sure, but the medical council has probably permitted some permission has been given for phone consultations. Otherwise phone consultations was something which was not looked at, because they were saying that a phone consultation can actually go wrong, which is true. But in these times, to screen and to at least give advice on the phone, we have, so increase access and reduce the cost. You sit at home, only go to the practice, have minimal staff, have minimal working hours, right? Always remember, it is the patients that bring in the patients. So don't forget the power of word of mouth. The mother comes to the practice, he'll bring his or her child if she's happy for orthodontic treatment, for pediatric dentistry, will bring in the husband for some dental care, will bring the parents probably for prosthetic rehab. You never know, will propagate you. So this is one thing which is needed right now. Reach out to your patients. It's all those who are practicing. Please increase your reach to your patients. They ask them, do you have any dental problem? Right? Organized dentistry is now the new feature. My previously part 1, 2, and 3 were all about organizing dentistry. Tomorrow, if we don't practice in an organized manner, it is going to be difficult. Now, this is that certificate which was I was trying, which you will get by going on to that. There is another website of WHO which is giving this. It is not World Health Organization, but there is a prefix before WHO. I'll just let you know at the end in the chat of what exactly it is. Go to that website, and there are multiple courses which you can do, including infection prevention and control for novel coronavirus COVID-19. This can bring in authenticity, right? So this, and you can download it at the end of the course. I would also share a little bit of American Dental Association guidelines for minimizing. So what you should do before dental care. First thing is prepare yourself and your team by ensuring safety, your office setup, your appointment scheduling, right? And once that is done, before even you take the patient in, you have to screen for COVID-19 status. And now, please understand this word, triage. Triage is the future tomorrow. We have a place in our practice where we can do a triage before he or she goes into the main areas where we work on the patient. So this is going to be very important, and phone screening is important, triage is important. Only allow those patients into your dental chair, onto your dental chair, which you feel requires dental care. Otherwise, we have to go to the model of doing, oral medicine consultation, minimal examination, and just treating what is required. Again, before there has to be instructions that there should be social distancing, including the waiting areas. There is a way that you can do. What we do is we tell the patient to sit in the car and not come to the clinic till we call them. They have to follow the infection control etiquette. They have to follow the respiratory etiquette. They have to wash their hands 20 seconds in your practice. You have to provide them with a sanitizer, if possible, gloves. And if they are not wearing a mask, you have to provide them a mask. Dental care, adequate precautions, standard precautions, transmission-based precautions, use of masks, respirators. Donning and doffing has become very important. How do you don on the PPE and how do you remove the PPE? That is also a procedure. And there are videos on it, on the social media, on the internet, they are available. As well as you can go to WHO website or any standard authenticated website where you will know what is donning and doffing. The equipment and supplies you have to prepare them well in advance so that prevents personnel from the infection. Your handpieces, equipments, your technical approaches will now change. You may have to go back and use a micromotor, for example. I remember my days when I did my BDS, we were not having an rotor. We were having a rotary handpiece with a string driven. It was not a triple section driven handpiece. And we used to cut the cavity. There was no aerator. There was no coolant. We will have to search of innovations. We'll have to wait till the industry innovates, acts, and brings a substitute for aerosols tomorrow. You must have a provision for steps after a suspected or an unintentional exposure has happened into your practice. Especially now between the patients, what are you going to do? That becomes very important. Cleaning and sanitizing all surfaces. Post-operative instructions has to be now given in writing, medications as adjuncts to care, and everything has to be in written, and you have to be extra careful. Even when you and your staff go home, you have to take a bath, you have to remove the clothes separately, wash them in like 25%, they say, lukewarm water, which is good enough to disinfect. You have to wash them, make sure that none of the things that you are carrying on your body, you take home and you expose that risk to your family members. So that is very important, not only for you, but also for your staff when they come and go. Tomorrow dentistry, you see now, this is a typical picture where I was working. Now, this is what we call as open areas, right? Now, previously also, what I was trying, dentistry was practiced in a way that we are being cautious about everything. But now we have to be extra cautious. We cannot have these open areas anymore, right? We need to have a face shield. We need to have, this is the new dentist might start looking like a robot tomorrow. But you see, a lot of people have said, like I attended Dr. Sandesh Michael's webinar, where he said a dental protective equipment where you need to, protect yourself till here. But I would still recommend that you wear this shoe covers, because that's very important, not only for you, but there are shoe covers even for patients. We need to authenticate. There has to be material which needs to come out. There has to be, we need to wait till some concrete, article or a guidance comes. Till then, we may have to be prepared with this kind of armamentarium in our practice to see our patients. And you start preparing now. At least have 1 or 2 PPs, 3 PPs, 4 PPs, 10 PPs in your practice, so that whenever they resume, you don't have to run. You have a patient and you need to treat. You have a PPE. Just authenticate whether it is effective or not. Your sterilization areas have become now very important. Your area should be well aerated, right? It should be now well ventilated areas, are so important. Your clinic has to be well ventilated. Minimal use of AC, they say, or you have to put in a HEPA filter. Now you see this negative ion is going to be very expensive. We'll have to use either fumigating machines that you use in operating theaters. We need to fumigate in between 2 patients. That is going to increase the cost, right? Autoclave is now going to become an exclusive, like a thing which will be needed in the practice. We already have lots of webinars, on this. So I'm not going in detail, but if you have this, you can leverage yourself and you can be more confident that yes, I will be working with this many, precautions, protections, and this is how we are going today, tomorrow, whenever we are going to start practicing. Ozonization of the water is very good, because whatever water that you use, if you ozonize it, it is considered to be a disinfectant. But we are awaiting studies on it. Fumigations. So these are the various ways that you can control. There's also an algorithms, again available on the American Dental Association websites, on interim guidance for triaging patients for emergency and urgent care, right? So this is the protocol, the algorithm that you follow, correct? And you follow this flowchart for triaging the patients for emergency and urgent care. This is to identify an interim guidance for COVID-19 infection. For COVID-19 infection, and urgent. So this is the algorithm that you follow when you identify a person with COVID-19 infection and he or she requires an emergency dental care. That has to be done in a well-established COVID center, but a dentist has to perform. So these are the various algorithms. The third algorithm is to minimize the risk of COVID-19 transmission for emergency and urgent dental patients, and HCP. So these are the various, flowcharts which are available on the ADA website again. So I have come out with my own suggestions, as much as I could think of in these times that we can do to leverage ourselves to cater to the dental health of the population tomorrow. This is a very small introduction. This is just a beginning of what I'm trying to do. I'm trying to create that awareness. I'm trying to bring, I'm reading the literature. I'm going to come out with more information, maybe in the next webinar, whenever we do after a couple of days. A part 2 of this series, for example, with advanced things, with newer things which comes to light. Again, like I'm saying, this is a disclaimer. I'm again putting, this is actually a pure awareness campaign that I'm doing of creating COVID-19 related dental issues, which may arise tomorrow for us, for dental surgeons, assistants, dental specialists, and the oral health care. And it should not be construed as a professional or a medical or a dental advice. Please act according to authenticated information that you have. So thank you very much for your patient attendance, and I'm sorry for shooting the time a little bit more than, so we would now, I'll stop sharing the screen and we can take up the questions and answers right now. So I'm going to unmute all of you. I would request to maintain the etiquette of only unmuting yourself when you want to speak, because it creates lots of disturbance. So Dr. Neha is there, right there. Hi Neha. So
hello, sir.
yeah, so I hope I did justice to the trust that you guys placed in me.
Definitely, there's no doubt about it. Thank you so much. And as you said, we have to be the best in whatever we do. I really appreciated the way the presentation was taken up, and a little bit of glitches were there, but that happens.
Okay, that happens.
Yeah, that happens nowadays. That's very common. So thank you very much, sir. And I really I hope that the students have benefited with this, because as soon as the colleges and everything will resume, they'll have their clinical postings and etc. Like they have to take care of a lot of things. So I hope that they have taken up the points that you have discussed. Like we need to we have to consider every patient as an asymptomatic carrier of the COVID infection
Yes.
while treating.
So,
So
the
these
articles
are
that I
all
have
these
shared, the
information that
articles that I have shared,
yes.
Neha, they are available on PubMed, and I would request all participants here to download those articles and read them. This recording is available on YouTube on my channel. So anybody who
Okay.
wants to go through those articles, or you could send me an email, or maybe you have my WhatsApp number. I will
Yeah.
forward you all the articles, Neha, then you can forward it to all the participants. We have the email addresses of all the participants.
Okay.
Probably we would send them the link for the PubMed articles, because for copyright reasons, we may not be able to forward the articles, but we can definitely share the link
Yeah.
where you can download all those articles. Very nice articles have come up in such a short time. People have done peer reviewed articles which are published in, not months, weeks, in days. That's commendable. People have doing phenomenal work. We must appreciate and we must be grateful to them.
Truly, sir. Truly commendable, sir. Yeah.
Right, sir. So there's like, if anybody has any questions or anything, then we can take them here, because I'm checking on YouTube whether anybody is watching on YouTube, and because the chat is not enabled on YouTube. Uh, yes, there is one now interested to buy pharma related to COVID-19 from India. Okay, so there are no questions on the YouTube chat as well, and so anyway, this was a good beginning. This is the first time that we also shared the webinar live on YouTube. It's something good now. So because a lot of people are wary of Zoom these days, they don't like to come on Zoom because of some reasons. Like we recently faced this problem with this called Zoom bombing, but that's okay. That happens. So Neha, we will schedule the next part 2 of this in a couple of days when I'm ready with it,
Sure,
and then we
sir.
can share the information.
Yeah.
I
Okay.
don't think, and thank you so much for this awesome response from all of you, and sending me. Yes, Dr. Mehul, I will send you the link for the PubMed articles. All the participants who have registered, I'll send them the link. But see, it's nothing very great. You just go to NCBI website, open up the NCBI website and type dentistry and COVID, and just press search, and you will get all the articles. It's very simple. You don't need to. There's no rocket science involved. You all know the NCBI website, so just type NCBI or type PubMed, and automatically those suggestions will come. They have recently upgraded their website to a much better web portal, which is very, very good, where you can search, and you can do a lot of things. And the best part is that all these articles right now are available free.
Yeah.
You will not require any subscription of any per article charge. So this is the time, we have all the time right now, and we can search for them. So let me check the chat if any other question is there. Mention the name of the book. Okay, the book is Subhima. It's known as, the book name is Textbook of Oral Pathology by Dr. S.N. Bhaskar. Miss Shubhima, I think you got it, doc there, that it's Textbook of Oral Pathology by Dr. S.N. Bhaskar. Yeah, I think it's an out of print book now, but I have a copy of it, which I bought I bought it in 1987 when I entered my third BDS. It's a fantastic book. It's a very small handbook, and the first 30 to 40 pages are blue in color, and they exclusively deal with oral manifestations of systemic diseases. And it's one of my favorite subject since my BDS days, though I specialized as an orthodontist. But diagnosing medical problems from, because there are so many oral manifestations, and it's something which we can now be of immense use to the medical profession. And COVID, you by the way, COVID, is it's a nosocomial infection where we are directly involved, and so we need to understand that more deeply now. Dr. Robin was there for some time. I think he's just.
No, I'm there, sir. I'm there
I'm-
only. Yeah.
Robin,
Great
I
lecture,
must
sir.
appreciate all the great work that you are doing, and thank you so
Well,
much.
sir, I just again want to just add all the participants. First of all, thank to you, sir, for arranging such a good lecture. Then I will just like to request all the young students and dental surgeons here that it's a time that we have to fight it. Don't be scared. Be safe. Be strong enough. And yeah, dentistry is going in a bad phase. Like it's a tough time for all of us. But we have to fight it together, and we will surely win the battle. So don't worry. We are there with you, and we will fight it together.
Yes, yes, Robin, very truly spoken as a true leader.
Thanks to all, and stay connected. Thank you, sir.
Thank you so much. Thank you, so all of you. And that is what we say, stay home, stay safe, but stay connected. Thank you very much, all of you. Have a nice time, and thank you for being here.
Thank you, sir. Thank you, sir.
Thank you.